Over the years, I've treated quite a few patients with active acne and also with acne scarring. I guess more generally, we have younger patients coming in with active acne who may be accompanied by a parent. And I try and work out pretty early on who is it that's actually concerned about the acne. Is it the parent or is it the teenager? Because that's really going to affect whether or not the treatment is taken regularly. And so that's important also to get across to the parent if their teenager maybe isn't that bothered about it. I think it's really important in your history as well to ascertain what treatments they've already tried, which could, for example, include antibiotics or even the pill prescribed by a GP. So it's very important to know what's already been done. Also, how bad is the acne today, what I'm seeing, compared to the worst that it has been in recent weeks? So I really get a clear picture about what I'm actually treating. Very often people come in and it's a lot better. Now, how many times have we as doctors heard, oh, well, it's got a lot better today, or it's disappeared, the thing that I came to see you about? It's going to be really very important to know what the maximum degree of acne is that young person is getting. We do explore diet as well, because there is a lot of evidence now that a high carb diet, sugary foods, and also cow's milk can be a precipitator for acne. So it's very often helpful to point that out to patients and their parents if they're there or if they're involved in the consult. I'd also want to know if they've ever experienced cysts with their acne, which may direct me to referral to a dermatologist so that they could be considered for treatment such as Roaccutane, which will help to prevent scarring, will reduce the scarring that they're destined to get from their acne. The other thing with history that I want to know is whether they've got any special events coming up, such as often it's school formals, when that's going to be, to decide whether I need to use something additional to my baseline treatment to get a faster impact for them. Sometimes, of course, people turn up very late in the game and we can't really help them because they're having their school formal next week. That said, a treatment such as a microdermabrasion can still help in the short term. When I come to examination, I'll be looking at the degree of the acne, of course. I'm looking to see if there's any cyst there as well clinically, and I'm looking for a blue hue around the acne spots that may suggest a low zinc level. What we find that zinc supplements can be really helpful then in preventing acne for those kinds of patients.